Okay, so meningitis is essentially just the inflammation of meninges. So, i.e., it's usually just an infection. So, it's more common in children than in adults. And the most common cause is viral, which is usually self-limiting. Bacterial disease is more rare and more serious. However, the incidence has decreased with vaccination. Clinical features of meningitis include headache. Obviously, the child has to be old enough to be able to say that they have a headache. Irritability, stiff neck, although this is not usually present in infants. Photophobia, tachycardia, and Koenig sign. So, i.e., when you have a flexed hip and knee is flexed and then you extend the knee, this leads to pain. And also, you can get fever, altered levels of consciousness, and poor feeding, vomiting, and seizures and signs of shock. So, with viral meningitis, causes include mumps, the herpes group of viruses. So, this includes EBV, herpes simplex, varicella zoster virus, and influenza. So treatment essentially for viral meningitis is symptomatic. So you want to deal with the fever, so you might want to give ibuprofen or Calpol. So bacterial meningitis, which actually could have been prevented with a meningococcal vaccine, is usually presents when there is a known infection which is present. So types of causative bacteria largely differ according to age. So investigations include lumbar puncture, where you have a diagnostic CSF analysis. And what you have to do is avoid having antibiotics beforehand so as not to mess up the results and have false negatives. So in terms of normal CSF, this is it does contain white blood cells, but the number is relatively low, and it's colourless usually, and it has glucose, which is over 60% of the blood glucose, and protein is less than 4.5. With the viral meningitis, white cells are raised. Again, it is colourless, and the white cells are raised, but it could be anywhere between 10 and 2,000, so that's a huge range. Glucose is usually normal, and protein can be normal or reduced. With bacterial meningitis, you get polymorphic cells, so cells of different characteristics. White cells are high and can be over 1,000, and it has a kind of a turbid appearance. It's not quite colourless. Glucose is low, and this is not because the bacteria is using up all the glucose. It's because there's altered glucose metabolism there. Proteins are normal or raised. So other investigations are possible. So you might want to do, FBC, blood cultures, throat swabs, but lumbar puncture is the diagnostic test. So in terms of management, you should have a low index of suspicion, so especially in a child. So don't delay. Initiate antibiotics within 30 minutes of arrival. And these antibiotics can be third generation cephalosporins, which with cefotaxime being a good broad spectrum choice. And you should administer these antibiotics IV. So there are several complications of meningitis, notably cerebral ones. So these include hearing loss, that's as a result of damage to the hair cells in the cochlea, vasculitis, which can lead to cranial nerve lesions, and hydrocephalus, amongst others.